Hey guys, my name is Christina Pham, and I'm going to be discussing case study 19 on the effectiveness of hand scrubbing. Our focus will be on Ignaz Semmelweis, a 19th century doctor whose discovery revolutionized infection control. So before the 1980s, it was really common for doctors and dentists to work without gloves or hand washing. But in the mid-1800s, Ignaz Semmelweis made a discovery that changed a lot. His work on puerperal fever transformed medicine and shows how hand washing remains one of the most effective ways to prevent disease. In the 1840s, puerperal fever was a terrifying complication of childbirth, with mortality rates as high as 25%. Doctors believed it was caused by an imbalance of bodily fluids and thought nothing could be done. But Semmelweis noticed something strange at Vienna Hospital. In the first division, where doctors and medical students worked, the mortality rate was 13%. Compared to the second division, where midwives worked, it was less than 2%. This stark difference sparked his curiosity and led to his groundbreaking discovery. The turning point came when Semmelweis's friend Jacob Kolechka died after cutting himself during an autopsy. Kolechka's symptoms were eerily similar to those of puerperal fever, and this led Semmelweis to hypothesize that doctors were transferring infectious agents from cadavers to patients versus midwives who didn't perform autopsies weren't spreading the disease. Semmelweis mandated that doctors and medical students wash their hands with chlorinated lime, which is a harsh cleaning agent, between autopsies and patient exams, and the results were really positive. Mortality rates in the first division dropped to less than 2%, matching the second division. And this was one of the first documented instances of hand washing significantly reducing infection rates. It was a simple solution with a profound impact. However, despite the evidence, Semmelweis faced a lot of resistance, and doctors rejected his findings, calling them unscientific and impractical. At the time, germ theory didn't exist, and the idea of invisible pathogens was really hard to accept. Additionally, admitting a responsibility for spreading the disease was a blow to their pride. Semmelweis was eventually dismissed from Vienna Hospital in 1849, but his work didn't end there. Semmelweis moved to Hungary, where he implemented hand-washing policies at St. Rochus Hospital. There, he reduced mortality rates to less than 1%. His work laid the groundwork for germ theory, which was later developed by scientists like Louis Pasteur and Robert Koch. Today, hand washing is a cornerstone of infection control in healthcare settings worldwide. Hand washing remains one of the most effective ways to prevent disease. In hospitals, hand hygiene protocols are strictly enforced, with gloves, sanitizers, and hand washing stations everywhere. In conclusion, Ignaz Semmelweis' discovery transformed medicine and saved countless lives. Hand washing, a simple yet powerful tool, remains essential in healthcare and daily life. Thank you.